Okay, today's lecture is have the lecture that is intestinal cestodes. The main intestinal cestodes are Tinea solium, which is also known as bookworm, Tinea saginata, the beefworm, and Diphyllobotham or D latum, which is also known as fishworm. Amenolepsis nana or ash nana, Diphyllidiums caninums. These are the main five intestinal cestodes we will study today. So they are the flat cross section. The hermaphroditic means there is one parasite having the both the sex, male and the female sex, they are present in one parasite. That means the sexes are not separated. Lives in the intestine with feces. The life cycles are complex. No mouth, no digestive system. They don't have it. They have sucker. They have teeth, and they grasp the whole. The reproductive structures behind the short neck and the repeated parts of the worm, each containing reproductive structures with the eggs and the sperms, which can be released with the host feces. The feces give the worm a ribbon-like structure, beneficial for the absorbing nutrients from the intestines. This is the tapeworm structures. It has colex, neck, and strobila or the trunk. General features are they're long segmented tape-like worms, that is known as tapeworms. They look like tapes, flattened dorsoventrally. They found in intestinal canal of human being and animals. Head is provided with sucker, slit-like or cup-like, and sometimes with the hooks. The sexes are not separated, hermaphrodites. Body cavity is absent, alimentary canal absent, excretory system, nervous systems are present. The reproductive is highly developed, complete in all segments. There are three regions the adult worms: head, neck, and strobila, as I already told you. There may be immature, mature, and the gravid. In the immature, the male female organs are not developed. In case of mature, the male and female organs they develop. Male organ appear first. But in case of gravid, uteri filled with eggs, other organs atrophy and disappear. There are terminologies. There are two types of main tenias, Tinea saginata and Tinea solium, which is known as pork tapeworm, and the Tinea saginata, the beef tapeworms. Tinea soliums are also known as armed or forked tapeworms. The Tinea saginata are known as unarmed or beef tapeworms. They are found in small intestines. Tinea solium, the larval form is known as cysticercus cellulosa, causes neurocysticercosis and epilepsy. The Tinea saginata is known as Cysticercus bovis, and it is found in cattle. It looks like this. The disease, the adult form of Tinea solium, causes tenacia, and Tinea solium larva causes cysticercosis. The important properties are identified as colex, which have four suckers around of the circle of the hook, and its gravid properties. The eggs appear the same microscopically as those of Tinea saginata and Echinococcus gravidosa. The infection caused by this tinea is known as tinniasis. Muscles, small, palpable, movable nodules, chest in the chest and the arms, mild and no fear, no symptom. It's your eyes are infected. They are known as ophthalmic cysticercosis. There is intraocular cyst floating freely in the vitreous humors. It affects the central nervous system. It is known as neurocysticercosis. More symptoms because of the inflammatory reaction associated with the cyst degenerations. Symptoms can be different depending on whether infection with the cysticercosis occurs, how many the cysts are there. Most cases are asymptomatic. The incubation period is up to 5 years. This is a subcutaneous nodule found in the head, limbs, neck, abdomen, and the back. This occurs in the tongue also. The brain is infected and it is affected as known as cysticercosis. The pathogen's adult tapeworm attached to the intestinal wall causes little damage. The cysticerci, on the other hand, can becomes very large, especially in the brain, with a manifested space occupying lesions. In clinical finding, most patients with adult tapeworm may have anorexia. Some may notice prognosis in the stool. Cysticercosis in the brain causes headache, vomiting, and seizure also. In the laboratory diagnosis, identification of tinea solium, finding gravid prognosis with 5 to 10 primary uterine branches. Eggs are found in the stool less than the less than of prognosis. CT scan can be done for the in case of diagnosis. The direct fecal smear is made when filtration technique is done and cellophane tape technique is done. In case of cysticercosis, that is when the brain is involved, biopsies of subcutaneous nodule, X-ray, CT scan, and MRI are done in the case of diagnosis. The treatment, neurocysticercosis is a vein problem. The problem of cyst and inflammatory reaction, use of parasitic, paracetamol or albendazole can be used. Effective treatment to control inflammation, corticosteroids and antihistamines are also given. In the prevention, health education, avoid eating raw bean, pork, avoid pigs eating human stool, sanitary inspection of slaughter, and sanitary disposal of night soil. The disease is prevalent all over the world except Muslim and Jews areas. The infection of the T. solium is closely associated with the method of pig raising and the sanitary conditions. Tinea saginata causes teniasis infection, and the TSA larvae do not cause cysticercosis. The important properties are Tinea saginate have a scolex with 4 suckers, but in contrast to Tinea solium, no plated gravid processes have 15 to 25 primary uterine branches in contrast to solium. Eggs are morphologically indistinguishable from those of Tinea solium. Humans are the definitive host, while the cattle are intermediate host. Tinea solium saginate does not cause cysticercosis in humans. Characteristic features are Tinea saginate, commonly known as beef worm, tapeworm, unarmed tapeworm is human. It is the intestinal parasite of human and cattle, causes teniasis in human. And infection is due to ingestion of eggs and infective larva called cysticerci of Tinea saginata. Cysticercus bovis is a larval stage developed in the muscles of cow and buffaloes. Epidemiology, most commonly in beef eating countries, usually of lower socioeconomic conditions and poor sanitation. 40 to 60 million people are affected worldwide annually. Most highly endemic tinea in the USA. In comparison, Australia, Canada, and USA are regarded as low area with prevalent rate of 0.1%. African country teniasis ranges between 0.2 to 8.1% based on the microscopy and between 0.1 to 119.7 based on copro-antigen ELISA. Pathogens eating beef meat containing Cysticercosis bovis are infective. Adult worms, while living in the intestine, usually do not give rise to any symptoms. Occasionally responsible for vague abdominal discomfort, chronic indigestions, anemia, and intestinal disorders, with diarrhea alternating with the constipation. The laboratory diagnosis, intestinal teniasis, we do stool examination, direct fecal examination, cellophane tape technique, concentration method of sedimentation techniques, and brand flotation technique. Observations of the prerogatives, the stool, by naked eye, biotic segments are easily recognized in dark yellow mass of the stool. There is a xenophilia serological test like IHA, ELISA, and antibody test are done. Clinical manifestation. Tinea saginata infection is generally asymptomatic. Have been infected infection causes weight loss, dizziness, abdominal pain, diarrhea, headache, nausea, constipation, chronic indigestion, and loss of appetite. It can cause pancreatitis, cholecystitis, and cholangitis. The incubation period takes 12 weeks for worms to mature into adult in the human intestine. Usually only a single worm is present at one time, although multiple worms have been seen reported. Pathogenesis and epidemiology. Little damage results from the presence of the adult worm in the small intestine. Epidemiology of genesis caused by T. saginata is related to the access of cattle to human feces and to the consumption of the raw or undercooked beef. The clinical findings are most patients with adult tapeworms are asymptomatic, but malaise and mild cramps can occur. In the laboratory diagnosis, the identification of T cell consists of finding gravid proboscideans, which are 15 to 20 uterine branches in the stool. Eggs are found in the stool less often than they are the proboscideans. The treatment pericontal, niclosamide, albendazoles, excision is best wherever possible. Diphylloprothum or D latum of the fish worm. The disease caused by this deletum of the fish worm is known as diphyllobrothiasis or the fish tapeworm infections. It is transmitted by ingesting the infected larva of the deletum, which is known as the pleurocercoids, in raw or insufficiently cooked freshwater fish. Are generally mild, symptoms mild, and can include diarrhea, abdominal pain, vomiting, weight loss, fatigue, constipation, discomforts. In small number of cases, they lead to severe vitamin B12 deficiency due to the parasite absorption. 80% and or more of the host intake it causes anemia called megaloblastic anemia, with neurological symptoms appear. Important properties, in contrast to the other cystores, which have sucker, scolex of dilatum, has two elongated sucker grooves by which the worms attach to the intestinal wall. Unlike other tapeworms, eggs which are round, dilatum eggs are oval and have a lid-like opening, all known as operculum at one end. The dilatum is the longest of the tapeworm, measuring up to 13 meters. Eggs are pale yellow and oval in shape, measuring about 70 to 45 micrometers. Has an operculum or a lid containing mass of gametid yolk cells surrounding an underdeveloped ova. Pathogenesis. Infection by D. latum causes little damage in the intestine. Some individuals, megaplastic anemia occurs as a result of B12 deficiency caused by the preferential uptake of the B vitamins by the worms. And the epidemiology of D. latum infection is related to the ingestions of the raw or cooked fish to contaminated bodies of fresh water with human feces. The clinical findings are most patients asymptomatic, abdominal discomfort, diarrhea can be there. And laboratory diagnosis, typical egg that is oval, white, yellow, yellow brown eggs at the porticulum at one end in the stool. Epidemiology, people at high risk of infection, should be those regularly consume raw fish. Many regional cuisine includes raw or undercooked food, sushi and sashimi and Japanese foods. They are also present in the Italian foods, French foods, and Scandinavian. The immigration and globalization, the practice of eating raw fish in these and other dishes have brought diphylloproteasis, which is an infection, to a new part of the world and create new endemic by the disease. Diagnosis made by identifying probability segments, characteristics of the egg in the feces. These symptoms technique are available. PCR can be done, and hence the stool examination and diagnostic. In the diagnostic eggs with the problems, treatment is done by the consequential and glucosamides. Freezing for control, how you control it, of 24 hours freezing throughout cooking or picking of fish, where the larva fish reservoir should be done under kept free of raw sewage. There is a treatment of praziquantel and glucosamide. Now the next one is the aminolepsis nana or ash nana. It looks like this. It's also common human cystode, and H. nana is the most common tapeworm in human, also known as the dog tapeworm due to its more in size and definitely host nana includes man, mice, and rats. It is only cystode that does not require any intermediate to develop into infective stage. The geographical distributions, H. nana can be found throughout the world, but can be found throughout the world, usually most common in temperate zones. This shows the buccal cavity of the H. nana and other. H. nana is known as dwarf tapeworm also. It is about 3 to 5 centimeter long, and infection causes it is a small tapeworm, smallest of the tapeworm in man. Adult is found in the ileums. It is a delicate trobila, short lifespan, transverse uterus. Subglobular foresuckers provided with the short rectal rostellums. Rostella hooklets are shaped like tuning fork. It is colorless. The egg is colorless all the way around, measuring 30 to 45 micrometer in diameter. Hooklets are present in the embryo. The egg structure called polar flame filaments are usually visible. Transmitted by injection, egg in the food or water, or from uh, internal auto-infection. Symptoms are very rare, serious, except in children, may cause abdominal pain and diarrhea. Patient with more than 15,000 eggs per gram of stool may experience cramps, diarrhea, irritability, and anorexia. Clinical features: enteritis caused by the cysticercoid, itchy anus, poor appetite, weakness, and severe and sometimes disseminated infections. Finding the egg or parasite species by direct examination, concentration technique examination, treatment of prazocontil, yeah, and niclosamides, prevention, practice personal hygiene, especially washing hands before eating, providing latrines, encouraging the use, especially by children, avoid eating uncooked food which may be contaminated with the human feces, and the decaninum. Tapeworm of cats and dogs, common names are cucumber worm, worms, and double pore worms. The casual agents are Diphyllidium scanninum, the common tapeworm of dogs and cats. The geographical range anywhere cats and dogs are present in Europe, Latin America, East Africa, South Africa, United States. Definitely cat and dog intermediate flea transmission injection via injection of infected flea. usually happens while grooming. Definite hosts are dogs and cats. Intermediate flea transmission lesions of infected flea usually happens while grooming. Adult one with 18, a good number, and the head is scolex with arms, rostrum, four rows of spikes, four section discs. It looks like this: double pore form. Clinical signs are most cases are asymptomatic, including cats and dogs. Severe infection can exhibit abdominal pain, diarrhea, itchiness, urticaria, red rash, extremely itchy caused by the body allergic reactions. Presentations are clinical presentation. Most infections with diarrhea are asymptomatic. Pets may be exhibited behavior to relieve anal pruritus. The most striking feature of animal children consists of the passage of the proglottids. In the diagnosis, observe gravid progress in the stool near the anal while uh, uh, shaped like proper seeds, usually intact. Observe over in the fecal matters. Treatment periquinters is very effective. Vector controls control fleas on pets and pets environment.